Welcome to my channel Health for You. 7 miscarriage symptoms and signs. Call a doctor. Could you be miscarrying? A miscarriage is defined as pregnancy loss before 20 weeks. After that, it's considered a stillbirth. If you experience a worrisome symptoms, it's normal to consult Dr. Google and start imagining the worst. However, remember that many of the signs of miscarriage can also end up being nothing to be concerned about. So, before you get too upset and rush to the emergency room, jot down your questions and call your OB/GYN to schedule a pelvic exam or ultrasound, since only a doctor can confirm a miscarriage has taken place. We talked to Mark Parlio, MD, the medical director of Georgia Reproductive Specialist in Atlanta, to find out the most common symptoms of miscarriage. Read on to find out if you are at risk and when to call your doctor. Spotting or bleeding. One of the first signs of miscarriage can be bleeding, ranging from light spotting to a heavier, bright red flow. Of course, many women who experience bleeding early on end up having a healthy pregnancy, but call your doctor to have it checked out just in case. Cramps. A crampy feeling in your abdomen could just be your ligaments stretching, but it could also be a warning sign that you are having a miscarriage. Call your doctor to make sure, especially if the cramps feel stronger than menstrual cramps, are isolated to one side, or are accompanied by bleeding. Vaginal discharge. If you notice unreal discharge, including blood clots or even a gush of fluid, it could be a sign that you are losing the pregnancy. Also, foul smelling discharge or discharge that accompanies vaginal irritation is called cause for concern. If you pass fetal tissue which may look grayish or contain blood clots, try your best to capture it in a clean container for your doctor to examine. Loss of pregnancy symptoms. Suddenly feeling fine after weeks of nausea usually just means your hormone levels have evened out, but this can also indicate a miscarriage, especially when it's accompanied by other symptoms. This one on its own is nothing to worry about, but if you have other symptoms of miscarriage, check with your doctor. A negative pregnancy test after a positive one. Miscarriage fears lead some women to take a repeat pregnancy test, even if they have already had a positive one, just to reassure themselves. If you get a minus sign after you just had a plus sign a few days earlier, it's a good idea to get in to see your OB/GYN right away.